a type of cancer in which mutations in genes affect the lung tissues and lead to a massive group of cells that cause lung cancer. Small cell lung cancer and non-small cell lung cancer are two common types of lung cancer. Direct smoking or secondhand smoking is the risk factor that influences lung cancer. An affected person's lung cancer is diagnosed by various tests, which include blood tests, imaging tests, or biopsy. That cancer could be treated by radiation therapy, surgery, or chemotherapy. Let us explore further the stages of lung cancer and their treatment. What is lung cancer? When cancer hits the tissues of the lungs, then it is known as lung cancer. The mutated cells usually develop in the tissues of the air passage. When a mutation occurs in the DNA of lung cells, the cells start forming new copies as a normal cellular function. However, they keep forming new copies continuously, even when there is no need for new cells. This uncontrolled cell division forms masses or tumors, which eventually lead to lung cancer. Sometimes, it starts in the air passage and moves to the lungs. It could also spread to other organs like lymph nodes, lungs, or even brain, and is known as metastases. It affects both men and women equally. Deaths due to lung cancer occur more frequently in the United States compared to the rest of the world. A report indicates that almost 200,000 new cases appear each year in the United States. How many types of lung cancer exist? There exist two main types of lung cancer: small cell cancer and non-small cell cancer. Small cell lung cancer. In this situation, lung cancer grows fast, but is found as small lung tumors, which spread to other parts of the body. It is often tough to treat this type of lung cancer. Certain types include oat cell carcinoma and combined small cell carcinoma. Non-small cell carcinoma. The most known type of lung cancer is non-small lung cancer. Almost 80% of cases of lung cancer belong to this category. Its further types include adenocarcinoma and squamous cell carcinoma. Adenosquamous carcinoma and sarcomatous are the less common types of non-small cell lung cancer. Some other types include when the cancer in the lungs moves to lymph nodes, known as lymphomas. If it continues to bones or soft tissues, then it is called sarcomas. When cancerous cells remain in the lining of the lungs, then it is known as pleural mesothelioma. What are the stages of lung cancer? There are two main stages of lung cancer. The first is the early stage. In this stage, the tumor is limited to the lungs, not spread to distant organs. Treatment of this stage is easy, just done by surgery. The second stage is the advanced stage, also known as the metastatic stage. At this stage, the cancerous cells spread to other organs. It is based on multiple factors like health, genetic history, the presence of metastasis, and its extender. What is the main cause of lung cancer? Just like other types of cancers, the main cause of lung cancer is also a mutation in the DNA of lung tissues. When any mutation occurs in cells, they start to develop in more quantity, ultimately leading to collective masses, which could be called tumors. When these tumors start to move, they're known as cancer. Which risk factors influence lung cancer? Smoking. It's the most adverse risk factor for lung cancer. It is reported that almost 80% of lung cancer deaths are due to smoking. 9 out of 10 cases of lung cancer are usually due to smoking in men and 8 out of 10 in women. A person who starts smoking in his early stage smokes more and inhales more carcinogens. Therefore, they have a higher risk of lung cancer. Lung cancer chances also increase if a person is a smoker or drinks alcohol on a regular basis. A smoker person, even after quitting smoking, has a chance of getting lung cancer. Secondhand smoke. When someone inhales the smoke of a cigarette, he also takes the same carcinogens, although in less quantity. Therefore, that person also has the same chance of getting lung cancer. Family history. If someone's father, mother, or siblings are affected by lung cancer, he has a chance of getting this. Environmental factors. If someone is exposed to air with carcinogenic chemicals or metals, such as chromium, nickel, or tar, they are also at greater risk of getting the disease. A person who is already infected by human immunodeficiency virus is also at greater risk of getting lung cancer. Chances of lung cancer increase in those people who live in exposure to radiation. Air pollution could also lead to lung cancer. Describe the symptoms of lung cancer. Lung cancer remains in the body for years without awareness, but the symptoms of lung cancer do not appear earlier. It happens when the disease reaches its advanced level. The signs include pain in the chest, blood in cough, breath shortness, pain in bones, headache, appetite loss, dizziness, face swelling and neck swelling, and weight loss. Pneumonia is usually considered the foremost cause of lung cancer. As the symptoms described later, it is related to pneumonia. How is lung cancer diagnosed? Diagnosis of lung cancer consists of various steps. Firstly, your healthcare provider will take a questionnaire regarding symptoms, health history, and family history. In physical tests, he will listen to the heart and lung voice by stethoscope. After this, chest X-ray and blood tests will be taken. Blood tests cannot find cancer cells, but the healthcare provider can determine how other organs are working. If these tests reveal that the person has lung cancer, the next step is imaging tests, which include a CT scan and biopsy. CT scan will tell about the cancer that spread or tumorous cells in pictorial form, and cancerous tissues will be tested by biopsy. In a biopsy, a sample of tissues is taken and studied under a microscope. Those samples are also used to test genetic changes. This thorough, detailed test will help to determine the best treatment. Describe the treatment process for lung cancer. There are two-way treatments for lung cancer, whether to get rid of it or to slow down its growth or process. The treatments usually help the body's immune system to keep them away. Some therapies are also used to relieve pain. Treatment directly depends on the type of lung cancer. Treatments include surgery, radiation therapy, chemotherapy, targeted drugs, and immune therapy. Surgery. In non-small cell lung cancer, cancer does not spread to other parts. The surgeon, during surgery, may take a piece of tissue to make sure that the cancer does not leave there. The surgeon sometimes removes the whole part of the lung's tissues to ensure that the cancer does not spread further. Radiofrequency ablation is used near the lungs to treat non-small cell lung cancer. These energy waves heat the cells and destroy them. In radiation therapy, the radiation of energy is used to kill the cancerous cells. Radiations are used in palliative care, and they shrink tumors and relieve pain. This treatment is used in both common types. Chemotherapy is another way of treatment. In these, multiple medications are used, which stops the growth of cancerous cells. In targeted drug therapy, a special type of drug is used to target the specific mutation which occurs in lung cells. These drugs will stop the growth of cancerous cells. Angiogenesis inhibitors are also recommended to create vessels in the lungs. Immunotherapy can strengthen the immune system of the affected person, which fights against cancer cells. Can lung cancer be prevented? By adopting some habits and avoiding some activities, it could be prevented, or we can say these could reduce the risk, which includes: quit smoking, the foremost cause of lung cancer. Try to avoid secondhand smoke also. Try to eat a healthy diet and maintain a healthy weight. What are the complications associated with lung cancer? If lung cancer is not treated on time and regular activities are not changed, then further complications could develop, which are: breathing issues mean shortness of breath, as the lungs are the focused organ for breathing purposes. Therefore, lung cancer can grow and block the airway passage, which leads to breathing issues. Coughing with blood is the second complication associated with lung cancer. In some cases, the blood leading severness, but there is treatment available to control it. In some cases, a special type of fluid accumulates in the chest that comes due to lung cancer. This fluid is actually collected there in the space outside the lungs, which is known as pleural space. This would ultimately lead to shortness of breath. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.